Okay, so should you see a chiropractor or a physical therapist? That's a great question. They're both different, but they're both great at what they do. So it's kind of helpful to know what they actually do, so you might be able to pick which one do you see, or maybe the answer is both. Hint, hint, it is both. So with a physical therapist, you primarily think about rehab when you think about physical therapists, and that's because they're great if you tear an ACL, if you tear a hamstring, if you have a specific muscular injury. They are very, very good at helping you heal that and progressively getting you back to functional performance. But the reason that they're good at that is because they focus on three main things when it comes to rehab and helping you get back to full performance. So for physical therapists, number one, muscle weakness, what they would do in that case, you might guess it, is actually strengthen that muscle to improve that muscle's ability to contract. And then number two, muscle tightness. If there's some tight muscles that are causing imbalance in the system, they would actually stretch those muscles to again restore balance to the body. And then number three is imbalances. And so you guessed it, by addressing tight muscles and weak muscles and creating balance in the system, physical therapists are able to actually help your body a whole lot through making those muscles all work together and progressively loading them so that you get stronger, more resilient, and have a higher level of function. So with chiropractic, they're also focused on restoring you back to full function and total coherence in your body, and they do that through three main ways. Number one, nervous system communication. So what we're looking for as chiropractors is in your body, the way that your body normally works, your brain talks to every single cell, tissue, and organ in your body. When that's functioning correctly, you're growing and healing and thriving the way that you're supposed to. But we've got 24 movable bones between our skull and our tailbone. And so at each one of those points, we can get a shift. And that shift puts pressure on the nerve that exits at that level and decreases the function of that nerve. So that decreased function can create tight muscles, pain, numbness, tingling, all kinds of things. And so what we do is we look for where those areas are where you might have a shift in your spine, and we do a gentle adjustment, just enough to relieve that pressure off the nervous system, and then your body's back to healing and growing and thriving the way that it's supposed to. So that's how we help the nervous system communication throughout the entire body. And that leads right into number two for chiropractors, which is whole body coherence and function. So by addressing those areas where we have a shift in the spine that puts pressure on the nervous system, by addressing that and taking that pressure off, we actually help to restore total body coherence and function so that your body works together as one functional unit. And then number three, restore proper alignment, which includes posture, but also, and even more importantly, is proper curvatures in the spine so that your spine can have full and normal range of motion. And so what we will do is take an x-ray typically so that we can see what type of curvature you have in your spine. So we should have 43 degrees of curvature in our neck and our low back. And so if we lose some of that curvature over time, that can actually impact how quickly our spine degenerates and accrues things like spurs and degrades the joint surfaces between vertebra. So we want to make sure we find out exactly how much curve we have, and if we have any loss of curvature, we definitely want to improve that to affect our overall health and just to have full range of motion. That's the main difference between chiropractic and physical therapy. Physical therapists are primarily focused on muscles and their performance and how they work together to give you full, fluid, pain-free motion. And chiropractors are focused on finding any areas inside of your spine or adjacent areas that might be causing pressure and causing interference to the nervous system. And that can happen through injury, it can happen through posture, it can happen through a bunch of different mechanisms, but they're focused on going from the spine and then outward. So they release the spine and any interference that might be happening there, and then let the nervous system do the work when that communication is restored back from the brain all the way to the body. And so once that communication is restored, then the body can heal, grow, and thrive the way that it was intended to. And then physical therapists are focused on finding muscles where there are maybe imbalances, weaknesses, tightness, and correcting those imbalances, correcting that tightness, correcting that weakness to restore function from there. And then that actually has an effect on the spine as well. So if you think about it, chiropractors and physical therapists actually are a great team. And so believe it or not, I work alongside of physical therapists. We take care of the same people. So sometimes we have an injury where a physical therapist will be primarily focused on helping out with the muscle imbalances, tightness, and weakness of a particular patient. And then I'll be focused on freeing up their spine as much as possible. Because if you think about it, are you going to have a better rehab with a lower functioning nervous system or a higher functioning nervous system? It's a higher functioning nervous system. If you're on prescription medications, are you going to have better results with a lower functioning nervous system or a higher functioning nervous system? It's a higher functioning nervous system. So in chiropractic, what we do doesn't negate anything that anybody else does. What we do actually can enhance or even help what other practitioners, other medical providers, anybody like that, whether you're also seeing acupuncture, PT, massage, all those kinds of things can help as well. But they all work better when you have a fully functioning nervous system that's not impacted by any of these spinal shifts. So to wrap it all up, both is the answer. So physical therapy has a great place in our system, and chiropractic also has a great place in our system, and they both work very well together.